So whenever there is anything foreign in the body, the immune system of the body will try to fight whatever the disease is, the foreign thing is. And one of the characteristics of bacteremia, or any time the immune system is trying to fight an invading bacterial infection, is fever. Even when you get malaria, the first thing that you'll feel is your body temperature rising. The body is trying to use its mechanism to fight the invading organism. So mostly you will have fever in the first week, and the second week now the typhoid will have spread, and it goes into the reticuloendothelial tissues. We have, that is the liver and the spleen, where it can cause some inflammatory reaction again. You end up with splenomegaly or hepatomegaly, and then come the third week, it invades the lymphatic tissues in the intestines. We have this thing is called Bayes patches, and this can lead to intestinal bleeding and also ulceration. So most of the time this is where you present with the diarrhea and vomiting. And if left untreated, you enter into the chronic stage, which starts at about 4 weeks. And the bacteria colonizes the gallbladder. You might become a carrier. And the chronic infections may involve the joints, the bones, the meninges, and also other sites. So one of the most distinguishing features of typhoid fever is something we call a step-ladder fever. If you are taking your body temperature, you'll find that in the first day, maybe your body temperature is 37. Then it will rise during the day and reach at a particular point, let's say 37.7. It stays at 37.7 for a very long time, mpaka the following day. And then on day 2, you will also again have a temperature spike that will go much higher than the highest level it went yesterday. So sometimes the diagram is drawn like that because it can come down and then again shoot higher, but sometimes we just draw it intermittently, like a ladder, someone going up, like steps. So in the first step you continue, the second step it rises and then plateaus in the next one, rises, plateaus in the next one. So that is what happens mostly in the first week, and you might end up with fever that can reach between 40 to 41 degrees Celsius. So this is just the way the symptoms come about. The end of the first week, and then you enter the second week, and then from the second week the third and the fourth. So this is how the symptoms might come about, and most of the symptoms have been mentioned. So if you end up with chronic infections, it might involve different organs, and one of them can be the brain. So if it gets into the brain, it can give you acute psychosis and confusion and delirium, and the other things are there. So in terms of diagnosis of enteric fever, the recommended one is culture. The reason for culture is because there has been antibiotic resistance to typhoid or enteric fever for the past few decades. So you find that most of the antibiotics we used to use before, they don't work. So culture, you can culture bone marrow, you can culture urine, you can culture feces, you can culture blood, and then you can also do those antigen antibody tests. I'll do the Widal test. In the first week of infection, mostly it is just bacteremia, and when you try to do any test in the first week, you will not find anything. It will be negative. You will also do the other test and maybe rule out malaria and the rest, but you'll never get anything in the first week. Most of the patients also, they don't present in the first week, because what they do mostly in the first week here is using of paracetamol to try and lower down their fever, as is custom to our people here. So after the end of the first week, when you are now starting the second week, blood culture becomes positive, and the positivity is between 80 to 90%. But after the fourth week, towards the end of the third week, you find that positivity of blood cultures becomes very low, and what you can do after the second week is the urine culture and also the feces culture most of the time will give you an appropriate result. You might miss the bacteria if you do feces culture in the second week of the infection. So in any case, you do blood culture and also you do all these other cultures, you find they are negative, but you still suspect that this person has Salmonella, then you can go invasively and take bone marrow biopsy, then do a culture on the bone marrow. You will find the bacteria there. Some other time we use the Widal test. So the Widal test is it measures some the typhoid bacilli contains antigen O and H. These antigens stimulate the body to produce antibodies, and a fourfold increase in O and H antibody titers paired between the specimens taken 2 weeks apart suggests that you have what? An active infection. You don't do Widal test once, then you find it is positive and you say this person has got typhoid fever or enteric fever. You have to repeat 2 weeks again, and if you find the titers increasing, then you diagnose your enteric fever. So with 70% sensitive but lacks specificity. And also we have some non-typhoidal Salmonella. There are other Salmonella strains which are not typhoid in nature, which can cross-react with the same test, giving you a false positive. And also people with liver cirrhosis also ends up with what? Testing positive for Widal test. So the culture, the diagnosis, I've talked about it there. The blood cultures you take, you do it in the first 2 weeks, and stool cultures usually positive in between the third and the fifth week. If you decide to go invasive, go for the bone marrow. Then the treatment of the enteric fever, you need to know that however much you'll be giving this patient treatment for fever and hydrating as much, the fever will not decrease until maybe 4 to 5 days after starting antibiotic therapy. So you need to notice that. For uncomplicated cases, you can do oral antibiotics outpatient. Severe cases and pregnant women, you have to admit these patients and do parenteral route or the IV route, and then switch them to oral as soon as they are stable enough. You need to closely monitor the complications that were mentioned, worsening abdominal pain, guarding, and the rest. So the choice of antibiotics, it usually depends on the susceptibility. How vulnerable is the kind of that strain of that particular organism to the antibiotics that you have. So if you cannot do culture, then you need to depend on the recent regional global data on the susceptibility of the strains in that particular area you are. So like you can find that antibiotics, chloramphenicol, ampicillin, cotrimoxazole, but you find that currently you try to use these ones, the patients will not heal. More than 70 to 80% resistance was reported. So due to this resistance, we've been forced to use mostly these antibiotics called fluoroquinolones, the likes of ciprofloxacin, levofloxacin, and the rest. So for those organisms which are resistant to fluoroquinolones, we use oral azithromycin to do that. For pregnant and breastfeeding women, we prefer using, if you are going oral route, use cefixime or azithromycin. If none of these are available, you are advised to use ciprofloxacin. Usually the life-threatening risk of typhoid outweighs the risk of the adverse effects of